Good evening, everyone, and welcome. My name is Paul Roach, and it's my pleasure to introduce tonight's panel, Fearless Critical Conversations on Stress, Trauma, and Resilience, a special event in HMRI's President's Event Series. Some of you may remember that nearly a year ago, we convened in this room to discuss the mental health crisis that are facing the children and the youth of our community. For that reason, we are immensely proud tonight to co-produce this event with Hillsides, a nonprofit pillar in the Pasadena community for more than a century, whose work in behavioral health, foster care, and youth services embodies resilience every day. Thank you for joining us. We're also pleased to have additional resources from Soluna, a free mental health app for youth ages 13 to 25, available at the back of the room. And at the conclusion of the panel tonight, we hope you'll join us for a reception in the lobby. We gather this evening at a moment when our community continues to navigate profound challenges. In the wake of the Eaton Canyon fire, many of us have experienced disruption, loss, and uncertainty, whether directly or through the lives of people we know and hold dear. Events like this remind us just how vital it is to have honest conversations about stress, trauma, and healing, and to ground those conversations in science, compassion, and shared humanity. It was 80 years ago, in the waning months of World War II, when science advisor Vannevar Bush published Science, the Endless Frontier. It was a visionary report commissioned by President Roosevelt that has helped define the American approach to research for the nearly century since. In it, he wrote, "Medical science has reached a turning point. The recent war, with its medical problems, has stimulated new research, new interest in medical research. The full benefits of medicine in terms of saving life and preventing disease can only be realized if we maintain a scientific research program devoted to the improvement of human health." His belief that research is essential to improving health outcomes remains as true today as it was in 1945. It's what drives our mission at HMRI. And tonight, as we explore how trauma and stress affect the heart and brain, we honor that legacy by seeking not just to understand, but to heal. With that, it's my pleasure to turn things over to our moderator, Dr. Julia Bradsher, CEO and President of HMRI.
Wonderful. Just want to make sure everyone can hear me. Okay, great. Well, welcome, and thank you, Paul, for your opening remarks, and thank you all of you for joining us tonight for this really special event focused on mental health. And here at HMRI, we investigate diseases of the heart and brain, including neuropsychiatric disorders. But generally, our discussions in this series have been really more about our research and translating that into the community. But given that our Pasadena, Altadena, LA County community has collectively faced trauma, grief, and stress in recent months, we wanted to create an opportunity to have a practical conversation about how our collective recovery and support can be achieved through mental and physical well-being in our community, and really just to have a conversation about how these things impact us all. So we've all experienced stress to some degree in our life, some more than others, and many have also faced trauma at some point. And so these events can be uncomfortable. They can be sources of uncertainty, anxiety, but they're normal aspects of the human experience. So our goal tonight is to help in some small way understand a little bit more about stress and trauma and their impact on our bodies. And particularly, we want to talk about some tools to help towards resilience. So let me introduce our speakers quickly. We're not going to go into a lot of detail about each speaker because I believe you've had the bios in the materials. But joining our panel, first of all, from HMRI is Dr. Robert Kloner, Chief Science Officer and the Chair of our Cardiovascular Research Program. Welcome, Bob. Dr. Anju Vasudevan, Chair and Scientific Director of our Basic and Translational Neuroscience Program. And then from Hillsides, please join me in welcoming Casey Meinster. She's a licensed marriage and family therapist and division chief for campus-based services at Hillsides. And
Thank you.
And I will also do a small little plug to say I'm also on the board of Hillsides, and I'm very proud that Hillsides is participating in this event and co-sponsoring it. So to make this a little more engaging and conversational, I'm going to refer to each of you as Bob, Anju, and Casey. So we'll take it away from here. So Casey, I'd like to start with you. In these months that have followed the fires, we've heard from people in our community who have described feeling foggy, anxious, emotionally drained, and some people have even called it post-fire brain. Could you help us to understand this phenomenon from a psychological perspective?
Yes, thank you so much for having me. So the idea of post-fire fog is really an informal term to describe a set of very common symptoms, both cognitively or mentally or emotionally after something like this. And I think the best way to think about it is, our body has a built-in alarm system, and it's designed to keep us safe. So let's say, for example, you're crossing the street and then you see a car coming that you didn't see before. Your body's alarm would go off. You're in danger, and that would allow your body to kick into action. Adrenaline would come through your body and you could run out of the way. That alarm system would take over the part of our brain that might be able to think more rationally, like how fast is the car going? Did they see me? Is it possible they'll slow down? That part of our brain has shut down, the alarm went off, and our body has kicked into gear. So as soon as you cross the street, you're safe, the alarm goes away. So you can imagine in a stressful experience like the firestorms we had, that alarm isn't just going off for a moment, it was going off for days. So your body is in that activated state, not just for moments, but for hours and days for those directly affected. And because a firestorm or a natural disaster is really a community event, even those, adjacent to it or knowing family members or, impacted by your business or your faith organization can still have that similar reaction. So that's what happens during a stress. And then in the days and months and even to this present moment after, we're getting false alarms that are going off in our body because there could still be perceptions of unsafety, fear of what could happen. So I think what happens is our body's in this activated alarm state. And so you get emotional burnout, emotional exhaustion, and our brain becomes foggy because we've lost access to the part of our brain that allows us to be rational, planful, and proactive because we've been in that more emotional activated state because of our body's alarm system.
Well, that's a really good introduction to my next question, which is directed to you, Bob. So Bob, you do a lot of research on heart-brain connection, and particularly you've done some interesting research on the impact of stress and trauma on the heart and the brain, especially during or after a crisis. So could you talk a little bit about that, and especially as it relates to what Casey was just talking about?
Right. Well, Casey talked about the alarm, and I think that's a key element here because we know that psychological stress that the brain perceives, will send impulses to the rest of the nervous system, which can stimulate the sympathetic nervous system and result in the release of adrenaline. And these cause a fight or flight response. So heart rate can go up, blood pressure goes up. The contractility, that is the way the heart contracts, increases. And all of these things increase the oxygen demand by the heart. And that's great if your coronary arteries are open and normal, but if you have narrowed coronary arteries from buildup of atherosclerosis and your heart is demanding more oxygen, you're going to have problems receiving that oxygen if there's narrowing in the coronary arteries. And some of this stress that occurs, the psychological stress, can actually cause spasm of arteries and spasm of the coronary arteries where they clamp down. And then there's an imbalance between the supply of oxygen to the heart muscle and the demand of oxygen by the heart muscle. And that can cause chest pain, it can cause heart attacks, and it can cause thrombosis or blood clots developing. And the same can also occur in the brain, leading to things such as stroke. We also know that this imbalance in oxygen supply and demand, when chronic, can cause significant problems to both the heart muscle as well as to the brain. And studies have shown that chronic stress can impact brain structure and function with a reduction in neurotransmitter levels, memory loss, anxiety, depression, headaches, loss of concentration, and an increase in mental health conditions. Chronic stress also releases a hormone called cortisol that can raise blood pressure, and that can also contribute to an increase in risk of strokes and heart attacks, and also worsen control of glucose levels, worsening diabetes.
Okay, thank you. Casey, back to you for a clarification. Could you help us to understand the difference between stress and trauma?
Yeah, so stress and trauma are related, but very distinctly different. So if you think of stress, it's just a very common stressor that, can happen in our life that triggers us to need to cope. So it could be a good stress, like you're getting ready for a big event, or it could be a bad stress, like financial uncertainty or a challenging conversation. Whereas trauma is more profound. Typically, trauma is defined by the exposure of what is either an actual or perceived risk of your own life or serious injury for yourself or someone else. Actually, Dan Siegel, who is a psychiatrist out of UCLA, helps us describe it by thinking of this idea of a window of tolerance. So if we all experience stress in our lives, but typically that's within our window of tolerance. So it might be a situation or something that's happening, like, for example, being a little bit nervous or stressed to be on a panel among real life scientists. So you could have some stress, but I'm able to cope with it by trying to be planful, looking for friendly, familiar faces in the audience. So it's within my window of tolerance. Whereas maybe prolonged stress or trauma is where our ability to cope is overwhelmed. So we fall outside of that window of tolerance, and it could create more significant impact, such as post-traumatic stress disorder, maybe substance use or other mental health challenges. And of course, I think chronic or prolonged stress could have serious impact as well. But generally, stress is something that's a little bit more manageable. And you have a little bit of time to recover before the next stressor or the next thing can happen.
And then a follow-up question to that is, how does stress and trauma impact mental health conditions, short or long term?
I think in the short term, you might experience symptoms like irritability, sleep disturbance. You might have some emotional numbness, or you could have dissociation. Those are more of the short-term symptoms. And unresolved trauma could lead to more significant symptoms, such as post-traumatic stress disorder or PTSD. You could have negative perceptions of your own sense of safety. It could lead to more serious mental health challenges like anxiety or depression or substance use disorder, or certainly medical challenges too, which I'm sure they could speak more to. So, that chronic impact on your body and brain can also lead to actual physical medical issues as well.
Okay, thank you. So Anju, I wanted to talk with you a little bit about, in your work, you investigate neurodevelopment and the role that neurodevelopment has in neuropsychiatric disorders. So from a biological standpoint, how does the brain develop even before birth and shape a person's vulnerability or resilience to mental health disorders?
Sure. So brain development, starting from before birth all the way through adolescence, is a dynamic process that is shaped by genetic factors and environmental cues. So there's always a genetic predisposition which plays a role in vulnerability to mental illness, but some of these genes are expressed based on environmental cues, which brings in the epigenetic factor, and that sometimes even transcends through generations and can have a very prolonged effect. So if we look at brain development itself, there are 3 stages. One is the prenatal stage, and that is a highly vulnerable stage. It's maternal health, which is very important at this point because the fetus is growing, the brain is taking shape, it's forming, and new cells are being born every day. They're migrating out to find their final destination. So brain organization is taking shape. It's a very, very big event. And stresses during this time can be maternal infections, exposure to drugs or alcohol or even tobacco. And if there is a change in brain organization at this point, there is no going back. It's just cannot be fixed. Once that time point is passed, you just have to deal with it. So it's a very, very critical stage. After that comes the childhood phase, and this is the time when brain growth is happening and experiences shape how the brain is wiring up. And it is also a very important stage. It depends on how the environment is. If a child is brought up in a very nurtured and supportive environment, then the child will show healthy brain development versus a child that is exposed to adverse events like abuse or neglect or poverty will have disrupted brain development. And finally, the third stage is adolescence, which is also a very sensitive time point because this is the time when brain structure and function is being refined. It's being fine-tuned through experience. And this is also the time when our teenagers are going through hormonal changes, and there is so much social pressure. There is a lot of peer pressure at school, which affects them and acts as a trigger for downstream mental health disturbances. So what really defines vulnerability versus resilience is the early life stress or trigger that can affect brain structure and function. And it affects how individuals cope with stress or anxiety. It's just because that region of the brain that regulates stress and emotion processing is affected. So they deal with it differently. And that increases vulnerability to stress. Versus what defines resilience is children who are brought up in a very protected and very nurtured environment will have stronger brain circuits. And so they will be able to adapt to such circumstances. They will be able to cope with stress. They'll come up with a new problem-solving skills, and they will have a positive outlook despite difficulties. And that is all what resilience is about.
Okay, thank you. Casey, back to you. Trauma can impact people of all ages, but how does the impact differ depending on whether it's experienced in childhood, adulthood, or later in life? In cases of significant loss, such as the destruction of a home, how can trauma reshape a person's identity or a sense of belonging?
Yeah, so if you think of it from a developmental perspective in early childhood, the impact might look a little bit different. So you might have disrupted sense of safety or trust. There might be some disruptions in self-worth. Usually in children and adolescents, they might not have the words to describe it. So that impact might show up in behaviors. It could be acting out behaviors. It could be withdrawal, shutting down. So typically you can see the impact through the actions and behaviors. Whereas in adulthood, there might be more life experience. So you can make sense of something like a natural disaster or a firestorm. That still could lead to impact of anxiety or survivor's guilt if you weren't impacted like your colleagues or your neighbors were. So in adulthood, you could still have significant impact. Oftentimes in adulthood, you'll see delayed healing because they might be taking care of their children or kind of putting off their own feelings. So sometimes the healing can be a little bit delayed. And then, of course, in older populations, senior populations, there's also, can be a sense of being untethered, losing potentially parts of your family heritage. So there can be different disruptions at all stages. But I think one thing that can all have in common is your routine is disrupted, your memories can be disrupted, so much of what tethers you or grounds you. So that's something that I think is commonly held across all developmental stages. I think it just presents differently depending on what your age is and if you have the verbal skills to be able to communicate and express what you're making sense of it. One distinct difference too is when you're a child, you might not understand. It might feel like it's this totality, like you're never safe in a home again, or you can't really understand that something could happen once and it might not ever happen again. Whereas an adult perspective, you could say, I've lived my whole life and this is the only time it's happened. So the odds of it happening again are lower. Whereas for a child or an adolescent, it could be harder to understand that. So it could be much scarier. Like we've seen a lot of kids refusing to go to school or to leave their home because in their mind is, will my home be there when I get back? So it's harder to kind of make sense of really big changes or impacts like this.
Okay. Anju, back to you with another question. So children in our community have been particularly hard hit. Some of them have lost their homes. They've lost their school. How do these kinds of traumatic events like this fire affect their brain development, from your perspective?
Yes, so a fire is definitely a traumatic event, and it can affect areas of the brain that are linked with cognition, emotion processing, and certain behaviors. So what this does to you is it just stimulates a cascade of stress hormones and peptides that can affect areas of the brain that are linked with memory and learning. So what should we watch out for in children who have been exposed to such trauma? Well, one is the cognitive aspect, which is a look at the way they pay attention. Are they able to pay attention, or can they focus? What about memory? Are they able to problem solve? How is their reasoning? So it's important to evaluate these events after the fire. Sometimes, if the trauma is prolonged, then it can cause structural changes in your brains. There are reports of brain areas being reduced in thickness, and these are areas that are linked to emotion processing. So structural changes have long-term effects in brain circuits, and that's not good as well. Something else to watch out for is behavioral changes, which is changes in mood or irritability and sleep patterns, because fragmented sleep is something that sets in after such traumatic events. And as Casey mentioned, this can also set individuals into a state of hyperarousal, which means you're always worried or reminded of that traumatic event. And it could be triggered by anything, a sound or a smell. And for instance, children, if they went into like a dark room and they heard a loud sound, they would just startle more than in a brightly lit room. That all of these are signs that there have been changes in their brain circuits, and there are changes in their stress hormones, and peptides have been released, which is modulating their circuits long term. And it's very important to make sure that they feel safe, not to expose them to images of such traumatic events. It's very important to help them with healthy coping skills like exercise or a creative expression. It is a great way to bring them back, and also social interactions.
So just a follow-up question on that. You mentioned about the circuitry is thrown off. Can the circuitry be reestablished?
There are ways to assess it. So today we have advanced modalities. If the stress is prolonged and the effects, the symptoms are persistent, it is important to look into it and find the brain area that's affected, and also base the therapy, with respect to the region that's affected.
Okay. Okay, Bob, I'm going to switch gears to you. And, some of your research has been on how these large-scale events like earthquakes affect our health, particularly cardiovascular. What have you discovered, and how might that be applied to our community-wide trauma that we've experienced, such as fires?
Sure. How many in this room experienced the Northridge earthquake in 1994? Quite a few hands went up. We were living about 10 miles from the epicenter. And, it woke up about 10 million people at 4:30 in the morning on January 17th, 1994. And it was an extremely scary experience. Our house shook. It sounded like a freight train went through the living room. Glass broke, chimney collapsed, hot water heater ripped out of the wall, all the lights went off. It was one of the few times I thought I might die. And I can tell you that I had quite a sympathetic surge, and my heart rate was racing, as were others. In fact, more people died from heart attacks on the day of the earthquake than from trauma. And we're currently looking at another study. In fact, Dr. Rashida Lavi, our Boswell Fellow, give us a wave, is going to be looking at the issue of the wildfires and what effect that had on coronary care unit admissions and heart attacks. So clearly, natural disasters like earthquakes, tsunamis, blizzards, cold spells are associated with an increase in cardiovascular events, including heart attacks and sudden cardiac death. Studies have shown that wildfires are associated with an increase in toxic particulate material in the air, and these particulates cause inflammation and oxidative stress in the lungs, and if they're small enough, they can actually get into the blood vessels and go to organs. They worsen lung function. They can then decrease oxygen levels, and wildfires have been associated in some previous studies with an increase in heart attacks, strokes, and cardiac arrests. So during wildfires, those especially with cardiac risk factors should consider wearing masks when the air quality is poor, stay indoors, and don't exercise outside, and consider air purifiers.
Are there any particular underlying factors or comorbidities that may make someone more susceptible than others?
Yes. People who have risk factors for atherosclerosis, that is narrowing of arteries, which is due to a buildup of cholesterol and fibrosis, calcium inflammatory cells, which can limit the delivery of oxygen because the oxygen carrying pipe is narrowed, are at risk. So these include risk factors such as high blood pressure, diabetes, high cholesterol, especially the bad cholesterol or LDL, low density lipoprotein cholesterol, smoking, lack of exercise, obesity. All of these are risk factors for atherosclerosis, and if you have these risk factors, you could be at increased risk for having an event when there's one of these natural disasters.
Okay. Well, we've talked a bit about trauma, stress, impacts on our bodies, and now I'm going to transition our discussion to talking about resilience and how those factors may help with health outcomes. So, Casey, could you help us to understand what does it mean by resilience and how individuals or communities can cultivate resilience after a traumatic event like we've just experienced in January?
Yeah, so when we're talking about resilience, it's really our ability to bounce back after an adversity or a stressor. Anju was talking a little bit about maybe some protective factors in our development, interesting early on, that might make that easier for some than others. But everyone has that ability in some way to be able to bounce back. I've met in my career some people that have faced extraordinary traumas and adversity, and they seem like some of the most resilient people I've ever met. And so some of the things that can help with that are the protective factors. So if you have a strong family support system, if you have positive adults or friends in your life, those positive social connections are what is some of the more powerful and substantial protective factors that help with resiliency. But also talking about what happened. We always say it's like a pot of boiling water, that if you put a lid on it and it's boiling, eventually it's going to, it'll spill everywhere. So you always have to let it steam out a little bit. So it's what we tell our children and families too, that it's very helpful to talk about it, because if you just keep it under the rug, you'll eventually have to deal with it. So having positive social connections, talking about what happened. Routine is so critical, especially in something like a firestorm where routine is really disrupted. A lot of people lost their homes, places that they go to, schools, workplaces. So your routine gets really disrupted. So establishing a new routine and some predictability can be really helpful. I also think it was brought up earlier, but another important thing is dosing your exposure to ongoing stress about the event or events that happened. Our bodies can only take so much in our brains. And so if we're dealing with the trauma in our community, on top of everything we see in the news and on social media and so many different doses of trauma, that can be make it harder to be resilient and bounce back. So kind of dosing out sort of how much you're exposed to and how much stress you're under, giving yourself time to recover from the stressful time points can really bolster our ability to be resilient. But I definitely think it's possible, and it's easier when it's within your community. And again, I can't emphasize enough the importance of the social in-person connection and support.
Okay. Bob, what can people do to reduce their risk of heart attacks or other cardiovascular events in the face of a prolonged stress or a trauma?
That's a good question. So there's some general things that one can do to try to minimize your risk factors: eating a healthy diet, getting regular exercise, plenty of sleep, and then relaxation exercises such as breathing exercises, yoga, massage, meditation, fostering social interaction, seeking professional counseling, and consider stress-reducing hobbies, and things like volunteerism have been shown to help in some studies. So really controlling cardiovascular risk factors is very important. And also anti-anxiety drugs may play a role in some individuals, and that's something you want to consult with your healthcare provider.
Okay, thank you. Anju, what are some of the advances in neuroscience and psychiatry that have given you hope around mental health treatment? Like, what do the options look like for tomorrow?
Yeah, I think this is truly a very exciting time for neuroscience and psychiatry because of the advances in genetics and biomarkers and imaging modalities that are out there today. What that means is that we can get a clear understanding of brain structure and function before actually going in with treatment plans. And it also means that we can provide personalized treatment that is tailored to each individual, and that is very important with respect to mental health. And with respect to brain treatment, what we mean is we can target the area that is affected. There are cases like targeted brain stimulation. For instance, there's deep brain stimulation, which is used in cases of depression. There's also a new therapy for children called SAINT. It's a great therapy that can be tailored to individuals, and this works through transcranial magnetic stimulation and by modulating neuronal activity in brain areas that are affected. And also there are advances in technology. For instance, there are apps out there, and the National Institute of Mental Health has really a great deal of information on that. And you can use these apps to check for changes in behavior, and that can signal out and send out messages for help. So with all of these advances and personalized treatment, I think there is hope. We can definitely get out of it and find a way to cope with stress and trauma. Great.
So Bob, back to you for a minute on, you had talked earlier about ways that people can reduce their risk of heart attacks and cardiovascular events. What are some of the daily habits or health habits that someone can begin to do to recover from trauma, protect their heart and their brain as we move forward in these months ahead?
Sure. Well, again, I think controlling cardiovascular risk factors is very important. So you want to control high blood pressure, control the blood pressure. That may include weight loss, avoiding excess sodium, and in some cases, medicines if lifestyle modifications alone don't work. Eating a healthy diet, low fat, exercising several times a week, trying to get enough sleep. If you have high cholesterol, again, diets that are lower in fat, and we have very potent medicines that reduce cholesterol, including statins, which have been shown to unequivocally reduce cardiovascular events. Control diabetes, don't smoke. If you use alcohol, use it in moderation. Again, stress reduction exercises may include deep breathing exercises, things like yoga, massage, meditation. And certain medicines may be appropriate in some individuals, such as beta blockers, which are known to decrease heart rate and kind of decreases that sympathetic system and help control blood pressure. Aspirin may be appropriate in some individuals who have known narrowed arteries. But again, you want to discuss that with your healthcare providers, and then professional help for stress reduction.
So Casey, one more question for you. So many children in our community have experienced loss that's really beyond their understanding. And we have among us today many parents, grandparents, and even some educators that want to support young people through this grief and trauma. How can they help build sense of safety, stability, and support for their children, grandchildren, and students?
I think the biggest thing is reassurance, routine, and connection, and also knowing that it might take time to understand fully the impact that this has had. So there's a suggestion to listen, both with your ears and your eyes, so you can see the behaviors and actions that might signal to you that there's something more going on. I also think it's helpful to really understand the importance of predictability and to answer questions honestly. There's an instinct sometimes to not talk about it or to try to push it aside because bringing it up could be anxiety provoking. But what we've seen is that creates more guesses in the minds of young people. So then usually that goes to the worst case scenario prediction. So if there are questions about why did that happen or, will that happen again, is to answer honestly in an age appropriate way, obviously not with hysteria or making it worse, but not leaving that space for the guesses or the worst case scenario predictions, encouraging expression, encouraging positive outlets off of the screens and into life and having happy, positive experiences. But I think the biggest thing is just understanding everyone copes and responds to these differently, that they're not alone. We're not alone in dealing with this. So again, the reassurance, the connection, and routine are really critical.
Great, thank you. So I have one more question before we open it up to the audience to ask questions. So I'd like to ask each of you to answer from your own vantage point, what is one actionable step that you hope people take away from our experience tonight about building resilience?
Okay, so I can share my experience with you. So we moved in 2020 during the pandemic from Boston to Pasadena, and we've weathered severe winters, the severe cold, and several snowstorms. And so when we moved here, we thought it was like heaven. And then the fire came in, it crept in. And I have two teenagers. I have a 14-year-old and a 16-year-old. And it was a very stressful week. We lost power for 5 days. We were close to the Eaton fire, and we were not sure whether we had to evacuate or not. And we were packing up. And at that point, I asked my kids, you can pack one bag only. We can take just one bag and pack what's most valuable to you. And what they brought out was all of their teddy bears from their childhood. I broke my heart. I said, you can take just one or two. Why are you bringing all of these? And when I saw the look on their faces, I realized that they were still holding on to their precious childhood. That was what was most valuable for them. And it was stressful, but we sat through it with candles in the night, and we played games, and we got through that week. And after a week, I asked them, do you want to go back to Boston? And both of them responded immediately, no. We don't want to go back. And that, I think, is an example of resilience because they adapted and they learned how to cope with it. And that was a big lesson for me too. And I learned from that. This was an experience through which I learned how to cope with my own grief and trauma that I went through.
Thank you.
For me, I would suggest walking away with the idea that there's nothing too small that can be so helpful. Oftentimes we'll hear from the children, youth, and families we work with, what is life-saving to them is usually the smallest thing. It's like someone checked in on them, and then that let them know that they were worthy. So it's not always these like fancy protocols and extreme gestures, big donations, huge actions that leave a lasting impact. It could be a phone call. It could be a check-in with your neighbor. Those small connections can be really life-saving. So there's nothing too small in terms of connecting and helping with those in your family or your community.
So given the heart-brain connection that we've talked about and the fact that stress as sensed by the brain can affect the heart, again, I would hope that people consider reducing their cardiovascular risk, keeping their blood pressure under good control, watching their cholesterol, their diet, and also consider stress reduction techniques.
Thank you. Okay, well, I'd like to open it up to the audience, and just a reminder, I always remind everyone that we'd ask you not to share personal information. Just try to ask your questions in a general way. So, Paul, I'm going to let you.
Larry, I see your hand. I'm coming to you.
Thanks, Paul. A question for Casey. I was very struck by your transition from in utero challenges to the mind, eventually, and post utero childhood and adulthood, and the stresses that they play on the development of the child. When I was in training and when I was in practice, we were presented with an awful lot of drug babies. There's a complete syndrome, as you know very well, better than I, of poor development, malnutrition, psychosocial changes, learning difficulties, and whatnot. Now we have we face being presented with a whole host of children that in the early post-utero phase were exposed to the stresses of the fires this year and in recent years, also which are giving rise to difficulties and challenges for people in your field. Is it possible to take and contrast the two different syndromes, so to speak, and how you go about managing them with their families, and also what is common with those two syndromes?
I feel like she might have a more specific example for that, but I think from a therapist perspective or from a psychological perspective, we definitely get clients that have had substance use or drug exposure in utero, or high conflict, very high stress, whether they're exposed to domestic violence or something like this. And so once they come into our office for treatment, we take that into account because we know the traditional strategies might not work for someone with a neurotypical brain or someone who doesn't already come in with those risk factors. So there might be some psychological accommodations that we need to make the interventions more digestible. But in terms of how those experiences are similar or different, I don't know if that's something you could speak to.
Well, I think we would begin with tests. For instance, you can take saliva or blood or sweat, and you can find stress hormones released there. So that evaluating the level of the stress is the first way to go, and to follow up with more personalized treatment and advanced imaging, or using functional MRIs to really figure out whether it is a response that has altered brain circuits. I think that's the way to go, whether it's a stress that can be managed by therapy or a stress that needs to be really taken care of in a professional manner. So there are two ways to go about it.
I'm just going to add a comment because I keep coming back to this in my head, and it's this idea of nature versus nurture. I mean, we've all heard that terminology, and what's coming to mind for me is this is very personal, but I'm about to leave tomorrow morning to go visit with two of my two brothers who are older than me, not that much. One's only a year and a half older, the other's about 4 years older, and we all grew up in the same household, but my two brothers were adopted from infancy at a public hospital, and my parents didn't know where they came from. They just know they adopted them. And here we are in old age now, or approaching old age, in our 60s. And my sister and I are both biological children, and we are thriving in life. And we both have these very successful careers, and we're, all these things. And my two brothers are living lives of chronic disease. One of them has vascular dementia, and the other one has Parkinson's disease, and a lifetime of health challenges. And it just really strikes me when you start to see how what happened, what Anji, what you were talking about. We don't know what happened to our brothers when they were in utero. We just know that we all grew up in the same household, but very different lives as older adults.
That's true.
Yeah, so it's probably something to do with when they were
And
in their formation in the womb.
right, the
Yeah.
genetic influence.
Yeah.
Any other questions?
I'll share one. If you want to hold it, I'm fine. In terms of the heart-brain situation, I would imagine it's a cycle, but is there one more overbearing than the other in terms of its impact on sort of the outcomes that we're talking about? And second question is, in terms of sort of first responders and students, we're starting to see sort of students starting at like the Sears building from Palisades and their school burnt down, and first responders that are returning back to work. Is there some time that research or practitioners recommend as far as on-ramping, or is starting them just like the normal cycle as we're seeing now? Some firefighters are back to work like if it never happened. Students did remote learning like the pandemic and now are back at school and campus. Is this too soon?
I can answer the first question. I'll leave the second question to you guys. Both the heart and brain are important, and there is sort of a two-way street. So when the brain senses danger and sends out this alarm that Casey was talking about, the sympathetic nervous system is stimulated. That can have adverse effects on the heart and cardiovascular system. The cardiovascular system can also have adverse effects on the brain. For example, in some situations where there's damage to the heart and enlargement of portions of the heart, like the left atrium, blood clots can develop in enlarged portions of the heart where there's stasis of blood, and those blood clots can break off as what we call emboli and travel up to the brain and cause things like strokes. Also, atherosclerotic narrowing in the blood vessels that go to the brain can also result in a decrease in oxygen delivery to the brain. So it's really a two-way street. And also the heart, if it has severe arrhythmias and is beating too fast or too slow, the delivery of oxygen to the brain can be impaired. And that can cause cognitive dysfunction and in some serious situations cause stroke. So it's a two-way street.
In terms of the timeline for intervention, they say the sooner the better. So that there's this idea that early intervention. So what we've seen in effectiveness studies is that if you're able to get treatment early, then typically the prognosis and the outcome is better. But it's never too late, but usually it's the earlier is better.
And I would like to add to that and say that it's better to get back into rhythm, into your usual routine as soon as possible. It's better not to delve on negative events and to start creating new work and new activities and come back into rhythm, which will bring you back on track.
I'm not quite sure how to ask this, but I think Andrew used the term unresolved trauma. What is resolved trauma or unresolved trauma? How do you know? I mean, what is the definition there that makes this something resolvable? Is it you don't think of it? Is it you don't notice it? Or is it, in fact, something that just gets buried and it's no longer active trauma?
That's such a beautiful question. One of the things trauma researchers will say in terms of it being resolved or unresolved is the meaning you have made of the event. Because obviously you can never go back and change what has happened to you. So when we say resolved trauma, we're talking about the meaning you made of what happened to you, and it's based in facts, not worst case scenario. So for example, if something happened to you and you think, like a firestorm as example, and you think we're never safe in our home, we're never safe, keep your bags packed, you're never safe, that would be an exaggeration versus if you're saying we might not be safe, it's good to be ready. So it's this idea of being resolved is your cognitions, the meaning you've made of what happened isn't interfering with your life. So you're still able to go out and live life. You're still able to make new connections. You're still able to take risks. You're still able to experience stress and bounce back, and that your perception and meaning you made is based in something that isn't interfering. But the idea of it being resolved or unresolved is quite subjective and might be different for everyone. So from a therapeutic perspective, it would be when you would see the symptoms go down. So is the trauma that happened to you continuing to interfere in your day-to-day life? Are you still having trouble sleeping, making connections, feeling safe in your body and in your community? Or are you able to go out and live life, make new happy memories despite of what has happened to you? So it's a very, very interesting, complex question. But generally, that's when we say resolved, is that it's not interfering in the way that it may have before.
And one way clinicians look at it is also to act on such areas of unresolved trauma, which is to give patients prolonged exposure to the same form of trauma in therapy sessions so that they learn how to manage it or cope with it. They come to terms with it. So that is also a way, but it should be done only in therapy. And it's a way to manage unresolved trauma.
Other questions?
I'm not sure if you can answer this question, but in terms of multi-generational trauma, how epigenetics are being used and where that's going in the future?
Yes, this is a big question. It's actually being studied in several labs across the US. In the past, it was believed that depression was, caused because of an event. It was very unique to the individual, but there are studies today that report that depression is something that can be passed on to your offspring. And there is a strong genetic link to this. And that's the reason why we believe that epigenetics today transcends several generations. It is under debate. There are many who believe in it, many who don't, but there is scientific evidence out there that it is carried on into the future.
I think we have time for one more question if there's anybody, and if not, we can finish up. Okay.
Just to piggyback off of what Anjun was saying, is it possible for an offspring, so let's say a parent has resolved their trauma and has gone through resilience, is it possible then for the offspring to still be affected or be passed down that unresolved trauma, or in this case, like, let's just use depression for an example, or is a child in a sense saved from that? I don't know if that made sense.
Yes, I get this question. I've seen this in meetings where this is addressed, the epigenetics aspect of it. There is also a paternal link to it. Some believe that it is through the DNA of the father, and it is being studied. I believe that the answer is not so straightforward, but there is a very strong link with the father in the case of depression. And why this holds on, it's not clear. Whether children can bounce back, again, I guess that's also a big question, but there is a need for an increased population. So to look at more or a larger cohort to understand this and the genetics behind this. But it's a hot topic right now.
Okay, well, thank you, all three of you, for helping us to have a better understanding of some of these matters. And I want to thank all of you for joining us tonight. Our next panel discussion is going to be in July. It's on Wednesday, July 23rd, and it's part of our annual Science Day. So it's during the day as opposed to in the evening. So from 10 to 2 on Wednesday, July 23rd, is our annual Science Day, where we're going to be featuring many of our students, our interns, and our postdoctoral fellows and their science. And they'll be presenting posters, and we'll have a panel here talking about STEM education and things related to that. So I encourage all of you to come, and if you would like to get more involved with us at HMRI, such as making a donation, I would love to refer you to Paul.
I'm here
or
all night.
any HMRI staff member who's here. And I hope you'll all join us for our reception, which is just outside of this auditorium. So thank you all for coming.
And thank you to the panelists.